HIPcast is brought to you by Enterprise Social Record.
And today we are continuing our patient advocacy series, and we've had a few interesting educational sessions. Actually, Seth and I have both learned from other educational sessions from the patient advocacy side of things, and we've been doing this for a long time. And today we have Ilene Corina with us. Ilene, will you introduce yourself?
I'm from New York, Long Island, New York. I'm a patient safety advocate. I like to think of myself as a safety advocate. Been doing this since 1996, and I'm board certified as a patient advocate. And love to be with patients and their families and help them through the healthcare system.
That's awesome. You all, anybody listening can tell that there's definitely a big swing between the accents that are on this episode. So I hope you can understand both sides of the conversation.
You mean I don't have a Long Island accent?
Today we're going to talk about why patients should advocate for themselves. We're going to talk about some resources that are out there, some very focused education for patients, caregivers, advocacy for how are you a better caregiver? How do patients advocate for themselves, or how do you advocate if you're a caregiver for someone else? And Ilene was recommended to do this series, and her resources, the resources are just rich and awesome. So thank you for joining us today.
Thank you for asking me to be here. I'm thrilled to be here.
Yeah, so let's start with that just massive topic of why should a patient or how can patients better advocate for themselves, because it's something that patients need to realize that they can stand up, they have a voice, they have a big part in their care journey. So how can patients better advocate during the healthcare process?
Well, most often what you just said is very relevant, because when people go into the healthcare system, they're not at their best very often. They're scared and they're injured or hurt or confused. So it might not be the best time to start learning to advocate for themselves. So we want them to be prepared before they go into the healthcare system. Our organization, we say it's not about your health, it's about your health care. It's preparing for the best possible outcome. And the why is because medical errors have been known to be a leading cause of death in this country. And we need to start talking about patient safety from all aspects, not just the healthcare providers who are teaching each other about medical errors and patient safety and how to get the best outcomes for their patients, but we need to educate the public on what their role is and their family members to support each other through the healthcare system.
Yeah, I think we sometimes get the white coat syndrome to where we just do whatever the person in the white coat tells us to do. And that's not necessarily the case. We know our bodies, we know our family members, we know their needs. So, it's really our role to help ourselves be guided through that process. And we can take advice from a provider, we can take guidance from a provider, but it's also our role as a patient to question and ask those questions and say, should I be doing this? Help me understand the organization a little bit. One of the questions here when we were talking about patient advocates, and how long the answer would be of why we should advocate as patients. But one of the items here was, why does pulse matter? I guess, what's the definition of what is pulse and why does it matter?
Well, I'll tell you exactly why, because we started as a support group for survivors of medical injury. I started Pulse in 1996 after my son died from a tonsillectomy in 1990. He was bleeding for 8 days, and I went to 5 different emergency rooms and doctors, and they all said, don't worry, he's fine. And then after he died, and I calmed myself a little bit, I said, nobody's ever asked me what I could have done different. And what if I knew then what I know now, could he have been saved? And measurement in positive outcomes is very difficult, because if he did survive, nobody would question that, because he should have survived. So when I started going through the support networking that I needed for myself to get through this, I realized people loved their doctors when their child had cancer or died in a car accident. And nobody was asking me what I could have done different. They were all very curious on how it happened and whose fault it was. And
Mm.
I liked the doctor, I liked the surgeon, and I liked the surgeon afterwards. And I wanted to work with him on improving the healthcare system. I couldn't because he was shut down from talking to me. But I
Mhm.
felt that if we could start talking to people who had these experiences, we could learn from them what could have been done different. And that's what we started, the support group for survivors of medical injury. And when somebody says, the doctor said this, but I didn't believe him, or I thought it was something else, that they've learned, they've caught a misdiagnosis. And I would never say in a moment that I know what a doctor knows. I did not go to school to be a doctor. But if I question something, or if somebody questions something, chances are they need to move on to somebody else who's going to listen to them. Because misdiagnosis is a serious problem in this country. Medication errors happen.
Yep.
Infection prevention needs to be stopped by patients and their families too, not just the clinician. So if we're prepared to ask a doctor to wash their hands because it would make us feel better, then we may be able to help stop infections. And a doctor or nurse might be really busy, may forget, and it's okay to remind them. So it's almost like when you think about if only half the people on the road knew the rules of the road, then we would all be getting in car accidents. But if everybody knows that a red light means stop, then
Mhm.
everybody needs to stop. And that's what we're trying to teach the public. What are the rules in the healthcare system that stops medical errors?
That's
Yeah,
fantastic.
I'd like to, I want to clarify or get a point of clarification. I think, first of all, we'll put the link to the website so you can find information about Pulse in the post when when you're listening to this, there'll be a LinkedIn post that you can go and look at and find this website. But Pulse, is Pulse an acronym for something?
It started out that way, but it is no longer. We
Okay.
separated. There was other groups, but we've separated
Okay.
from all the other groups because we have a very specific mission, goals, a very active and professional board and consultants and people that we work with very closely. So we're completely independent of any other organization. It was Pulse of New York, which is our legal name or professional name, I guess, but we definitely are. Pulse Center for Patient Safety is what we focus on.
Very nice. On your website, icorina.com, there's a question that says, what does making meatloaf have to do with communicating with your provider? And let's tell the patients the answer. What's the answer to that question?
Well, it's part of our training. We do a family-centered patient advocacy training, which is about 9 hours, and I'll give it away. But if I so let me ask you, do you mind me doing this? I'll just do it with you, Shannan.
Yeah, let's
Do
do it.
you have a meatloaf recipe? Do you know how to make a meatloaf? So
I
share.
know how to make a meatloaf. Yes.
What is your meatloaf recipe? Tell us your meatloaf recipe.
I use hamburger. You want the ingredients list?
Just it's a recipe.
Okay. I use beef and onions and red bell peppers because I don't like green, and eggs and stale bread and ketchup. And I make the mixture where it sticks together, and I put it in a pan and I bake it for, I think it's 40 minutes on 350.
Okay, great. Now, Seth, what did she say?
She told me I should go to my mother's house because I'm going to eat my mother's meatloaf.
We like to think of it as first, you didn't say the measurement amount. So if you were talking, your doctor's giving you an explanation of something, we should think of it as a recipe. And if you can't repeat back exactly what the doctor said,
Good.
you don't understand it and you didn't follow it, then you need to do it again and write it down as if it's a recipe. And that's the making meatloaf recipe.
That's really good because even if Seth had attempted to call it back, because I'm a ketchup meatloaf base girl, not a gravy. I don't want the gravy, and Seth obviously wants the gravy. That's why he's going to his mother's. So, but it's important what you're saying for patients. Not only are we sometimes, we know the doctor's in a rush, the providers of care are often in a rush, and then also if it's a complex patient, there's so many things that are being covered in this discussion that for this medication, it could make you dizzy, or this medication, could make you have to go, go urinate often. Like there are so many things, and you can't keep that straight. It's almost like we need ambient listening for the patient so they could take that information home with them, right? Not just have it for the doctor for transcription. But basically, even if Seth tried to repeat back that recipe to me, he might have gotten all of the ingredients. He might have left something out. If he did get all the ingredients, he may have said to me, you're going to bake it for 20 minutes on 350 degrees, which would have been very undercooked. And so it would not have applied. So I love that you make it that simple. It's not just the ingredients, and it's not just the instruction. It's the entire picture and how they correspond with each other. So I love that example, although I do wish Seth had try to speak it back.
You didn't even say how much of anything you used. So even the fact that you say a cup of something or a pound of meat, a pound of chopped meat, that's the pieces that we want people to realize in our training classes, that truthfully nobody ever gets it. So what you did is exactly what I expected, because that's why we do what we do.
Yeah.
And it's interesting because you apply that to a healthcare scenario, and many patients have very complicated medical histories. So they may be seeing a physician for a specific condition, but that physician is only treating that condition, not the whole patient, from everything. So, I may have, I may be making meatloaf over here, but it would be strange if I was making something totally different, like a fruit salad, to go with it as a side, because it doesn't, those two things don't go together well. But as a patient, and what we hope that folks understand is, it's your responsibility as the patient, and you have the right to question these things, to say, why are you making meatloaf? Or I have these three other things that are going on. And I take care of my brother, and I take care of my uncle that has a fairly complex medical history. And, as he was going through different things, we noticed that he was put on 3 medications that do the same thing, but it was through, one was a local provider, one was the VA, another one was at the hospital. And it's like, well, wait a second. These 3 medications are doing the exact same thing. And you're wondering why his blood pressure is bottoming out. Well, that's because they didn't, each physician's solving the problem of the moment, not necessarily looking at the patient as a whole, what we used to call longitudinal care, right? And it happens. So those medical errors definitely occur. And it's something that a patient needs to be aware of, is they need to not only know and listen to how the meatloaf is made, but also share, hey, I also have this going on, I have that going on. How does that affect my meatloaf?
Yeah.
For a lack of a better way to put it.
Yeah, it could be as simple as, I don't have any eggs. What can I do to substitute eggs, right, for my meatloaf? So it could be that simple.
Yeah, we like to think, I like to think that, the advocate as caregivers, if you're taking care of somebody, Seth, you're an advocate.
Yeah.
So there's professional patient advocates now, independent professional patient advocates who are getting paid for this. I don't get paid for it. I've been doing it for 30 years. My passion is to pass down information to the family members, because family members in most cases, want to be helpful. But when they come to us, and our focus, or my focus at Pulse, and we're all volunteers, but the focus is to work with the family. So if somebody calls and says, I need a patient advocate, could you be my patient advocate? We'll bring in their family members. And who is the person that's going to be with you? And the family member might say, look, I've been a patient advocate. I'm great with this. I could yell and scream at the doctors all day long, and they have to listen to me. Well, you know what? You never get a second chance to make a first impression. Yeah. So maybe you need to step aside. And as an advocate for a very close friend of mine, I needed to call in somebody that I trained, because I was not thinking straight. And I knew we were missing something. What am I missing? And he came in and sat down and said, did you have the family meeting with all the doctors and nurses? I said, oh my God, I completely forgot. So we're all very vulnerable at a time when our heart is involved in healthcare, that we're hurting and we're scared and we want to be helpful and overwhelmed, that if we need another person to step in, I could work with, or anyone from Pulse really could work with the family to help them to see what might be missing, whether it's recently somebody was called his doctor for to raise the anxiety medication because he was feeling very suicidal and anxious and really scared and upset. So I got on the phone with the psychiatrist and said, you know what, I just realized this started 2 weeks ago when we started planning a colonoscopy. And I went back to the patient and said, did this start 2 weeks ago when you started? He goes, oh my God, you're right. Canceled the colonoscopy. It's not worth it right now. We'll plan differently. So it's, as an advocate, thinking outside the box a little bit, thinking about what could this be, and not pressured with 1,000 patients like a doctor might be, and being able to support the patient's experience and all what's going on with them. And we could do that as a professional patient advocate or a family member and friend.
That's so great. So I want to clarify for patients or family members that may be caregivers, that the folks that find themselves in a position to be a caregiver, they can connect with the Pulse Center and receive education on how to be an advocate for their person. You're saying yes. I just, for the folks that are not going to watch this on video, Eileen is shaking her head. Yes, that is absolutely true. This is important. And by the way, thank you for that level of work. I can see that it's your passion project and you've been serving people for 30 years. So thank you for doing that. But I think it's so important that folks know there is somewhere, you don't have to be alone in this. There are people there like Eileen that will help guide you through, not just give you the fish, right? Teach you to fish. Here are the tools you need, and call us if you have any questions, right? We can help you through if there's something you miss. You want to talk a little bit about that from the perspective of the Pulse Center for Patient Safety and Education?
Well, we have 3 programs a month. Almost every month we have 3 programs that we stopped for the summer. 2 are lectures or presentations from healthcare professionals or professionals in the business, that they're lectures and then a discussion. And there's we have somebody who's hosts that. And the patient activation, which is my favorite, patient activation through community conversation, which is an open discussion. Patient advocates come on, caregivers, anybody can come on to that. And I'll give case studies or actual conversations I've had with people, or things that are happening with people, or people can come on with their own questions. We actually were doing this when I got a phone call from somebody who was in the hospital with her brother and was upset about how they were being treated and cared for. And I put her on speaker, so it was a phone call. So the group could hear at the same time what she was going through, and then we could all work together to help her through this. So the PAC is an opportunity once a month for people to come on a call, bring your questions, bring your suggestions, bring your experience, and be part of the conversation. It's a 1-hour discussion, and board certified patient advocates get continuing education for this. Again, it's if nobody comes on has a conversation, then I'll bring in the case studies that we're working on. And then the ACEs, Advocate Collaborative Educational Series, is a PowerPoint presentation and a discussion. And then People for Patient Safety is a presentation and then open discussion also. So they're each opportunities for people to come on. The only one that doesn't have an agenda is the PAC. So people can come on with their own questions and concerns. And somebody was asking this summer about treating somebody who has drug addiction, and how do we do that? Bring it to the PAC. Let's see what people are doing. What are they doing? And we're not looking at professionals to tell us what to do.
Yeah.
Our programs are all about, here's what I would do. We're not going to tell you, Shannan, this is what you have to do to make sure this works. This is what I would do. There's no lecture. I'm not going to tell you what you need to do. This is not, my opinion is my opinion and my ideas only. So we don't want people to feel obligated to follow what we're saying to do. We're going to learn from each other and maybe change people's opinions and the way they do things.
That's incredible.
One thing that sparked my mind is, I think
Yeah.
when we first started this conversation, I was definitely going down the path of, as a patient, I have to advocate for myself inside of my healthcare journey.
Yeah.
But as we've talked, it's kind of come to my mind that we do take care of family members or friends or people that, extended folks in our community, that we can become a patient advocate for someone else. And Shannan, I often use
Yeah.
my mother or her dad as examples in different conversations. But there's coming a time here to where my mother's going to need someone to help advocate on her behalf inside of the healthcare process. So this is something that applies to pretty much everybody, because at some point we're all going to be there. And even at that, I guess, if I think about just the whole thing, like if my wife has an issue, I got to make sure that I'm advocating for her. If my kids have an issue, I got to make sure I'm taking care of them and helping guide that process. And can you talk more about that role of helping a family member or even a friend in the community?
Yeah, and are you too close to your wife to be able to do that? Because again, you may be too close. You may get angry at the doctor who blew her off, and now you're mad at the doctor, and that's going to come out in a conversation. Or can you actually ask, does your wife want you there? Are you too emotionally invested in that? And who else would step in? Could somebody else step in? So again, it could be a professional patient advocate, or you call, and I'll talk you off the ledge if you're that emotionally invested in what's going on with your wife, and see things differently. Are you angry at the doctor? Let's talk about it and how you might approach the doctor in a different way, or how you might question the care. You don't want your wife to get that treatment. Your wife wants that treatment. How do you come to terms with each other on what you want and what she wants? So there's a whole aspect of care that we don't address because we're either emotionally invested in it, or we just don't know what to do. I had a husband call from the hospital that he wanted to be with his wife overnight, and they wouldn't allow him to be. So I called and he was fighting with the staff at the hospital because of it. There were nurses that were with his wife, but the nurse couldn't make it that night. He hired nurses. So I called the director's office, and because I was calm, so I called the director's office and explained, I don't give out the patient's name. I want the patient to call them. I'm trying to make a connection. So when he did say I should tell him where it is, what room they were in, and who they are. The director said the reason nurses are allowed to stay at night is because they've had their vaccinations, and that's why they can be there overnight. And I said to them calmly, well, if he didn't have his vaccinations overnight, he probably didn't have them during the day when he's there either. They went right in and told him he could stay because, thinking differently, this is what the excuse they're making to him. This is what he's hearing. And now he's getting angry at this, but it made no sense. And thinking, again, I'm outside the situation. I don't have the emotional baggage that I could think differently and help calm the situation. And it worked out well. So those are the things that we want to be able to help. We want you to be there for your wife, but we also want you to get the best outcomes possible by being her support. And if there's a family member or friend that could step in for you, then that might be best. And you just be her husband. You just love her. And sometimes that's what we have to tell people. Just love them, and we'll step in and help how we can.
Yeah, I think she would tell me, get out. she would want to deal with it on her own.
She, by the way, is a nurse, so
yeah,
she might
patients. I hear they're not the best patients.
They're not the best patients, and that is a very true statement. But one thing that you've mentioned is, and we've talked about the Pulse Center for Patient Safety Education and Advocacy, and what we will do, as Shannan mentioned, we'll put the link, which is pulsecenterforpatientsafety.org, in the show description below, and we'll have it in our post. But one thing that you've mentioned is professional patient advocates, and that's probably something that most patients out there probably aren't aware of, that those folks exist out in the world. And I know you guys are in New York, and this is going to go out nationwide. If I'm sitting there as a patient or as a family member of a patient, and I'm like, I just need help. This is complicated, and I can't figure out how to make this meatloaf, or this meatloaf doesn't make sense. well, how do I find professional patient advocates to help?
There is a website that's collecting patient advocates, Greater National Advocates, gnanow.org. I will give them a plug. And of course, we want to help, virtually, we can always help. But that might be somebody in your community that can go out with you and be there for you. It's not inexpensive. They get paid for this. So that's one of the reasons that we've been doing this so long that we've never gotten paid. We've never taken money. And actually, the donations we've gotten from people probably outweighs what we would get paid for. So the idea would be to go on this website or just Google, I think, professional patient advocate, independent professional patient advocate. There's board certification. I don't know if that matters tremendously. I'm board certified. It means I passed the tests. We also give classes and courses. They have to keep up with that. But it's a relationship building. You have to find out if this is the person for you, if this is the person you want, what their knowledge is. And professional patient advocates do everything from billing to insurance. There's different types. Our focus is safety. That's, if you come to me that you have a home, you want safety in the home, we're going to ask you to find somebody else because that's not what we do. If you're under the care of a healthcare professional, we want that experience to be a safe, positive experience. And again, it's really hard to measure positive outcomes. So when we do get really good outcomes, we just expect that. So a professional patient advocate could be board certified or not. And we're encouraging people that if they take our courses, come to our programs, put a dollar amount on your services, whether it's $20 to sit at a bedside. Our goal is to build a community of professional patient advocates that might get paid $20 an hour to go to the hospital and sit at the bedside so the wife or husband can go home, take a shower, get some sleep, or go to work. And we've trained them and are on call and available to answer questions. But that's really the ultimate goal, because that's where errors happen, is in the healthcare system. And when somebody's in the bed at the hospital, that's where mistakes. I've seen so many mistakes happen and been there to catch them, which is exciting for me because I witness mistakes happening and be able to say, whoa, I just saw that happen. I can't believe I just saw that for myself. And we just want to make sure it doesn't happen. Mistakes don't happen.
Yeah, I think that's another key point, that the patient population that's out there listening to this, or just those that are taking care of a patient, is that mistakes are going to happen.
Yes.
We're all human. I often tell folks at my church that seek advice on the healthcare process that keep in mind the physician is simply practicing medicine. It's not a guaranteed science. It's a practice.
And keep in mind that if I'm driving and I change the radio station in my car, I might kill somebody. If I'm looking away for a moment, and this happens, it happens all the time. We hear about accidents, terrible accidents. So this is how mistakes happen. It's not, it can be avoided if we're very careful and observant and know what to look for. It could be something as simple as giving the wrong patient medication. It could be a misdiagnosis. It could be catching an infection. All those things matter. We have, I don't know if I mentioned the Take Charge campaign, which is the 5 steps to safer healthcare. And we're hoping to build ambassadors for Take Charge across the country. That's the first steps to being a patient advocate for somebody, is following the 5 steps, helping someone fill out their healthcare proxy, not your whole will and estate planning, but just the healthcare proxy, which is going to be asked when in your admission packet. So why would you wait to have that conversation? Who's going to be the person you're going to go to if you can't speak for yourself? Don't wait until you're going into the hospital. Have the conversation ahead of time. So the 5 steps, that website's takecharge.care. It's a program we came up to, just 5 basic steps to prepare to become a patient, and a family member can help do that.
That's amazing. These resources are so rich, and you have just continued to see opportunity. I appreciate that you mentioned the different segments of patient advocates, and that there's, for safety, and there's for healthcare, and there's for, different, safety at home versus being in the hospital, and navigating appointments, right? Like all the different components of that. So even if it's not this type of advocacy that we're talking about today, that a patient or a caregiver needs to find the appropriate education for that segment of patient advocacy and get equipped, right? There are resources to get equipped to help take care of your community, whether that's family or you're just doing it in your community as volunteerism or as a paid service. This has been incredibly rich. Your resources are great. If you have, actually, we all have someone in healthcare. If you can hear this, go check out the resources on these websites, because you will learn something. I mean, I will learn something. Seth will learn something. You will learn something. Eileen says she learns from challenges that she has with patients, or with the caregivers as they're walking through, seeing those mistakes that she just mentioned. Those are things that she hadn't seen before, right? So the first time that happens is the first that she's seen is the first time she's seen it, and she's learned something new to watch for, something new to ask about, something new to advocate on behalf of that patient for. This has been incredible.
Thank you.
Yeah, it's really a fascinating topic, and it's something that folks need to be aware of. And now I want to go to take charge, because I need to learn how to be a patient. And so I think those are great resources. Again, I'll try to put those in the links or in the descriptions as well for folks. And Eileen, any parting words for those out there in the patient community that are looking for resources and help?
Well, we're available. Please check out our website. We're always updating it. We have people working on it. Our volunteers and team are working on that. If you learn something, I think a priority to me is to get people to our programs, because we're learning from each other as we discuss this, an opportunity to talk about our experiences. So if we get people to our PAC program and check out our programs, we'll learn more. We could be together. It's all on Zoom. It's all, virtual, and we can learn from each other. So that's really what excites me is to get new faces there saying, I want to help somebody. I want to learn, because I'm going to learn from them. I'm no expert. We'll learn together.
Yeah, it's great stuff. Well, thank you again for joining us, Shannan. Until next time, my friend.
See you next time, buddy.